Assalamualaikum and good afternoon. I am Muhammad Razif bin Rusidin, Unit Supervisor at the Emergency and Trauma Unit, Hospital Ranau, Sabah. Today, I will present a case study examining organizational behavior and learning practices in our unit. Alright, let's begin. Healthcare organizations require effective management, strong leadership, clear communication, and continuous professional development to deliver quality patient care. Our emergency and trauma unit operate 24 hours per day, providing immediate care for medical emergency and traumatic injury. Success depends on seamless coordination among our multidisciplinary team of doctors, nurses, assistant medical officer, and support staff. Hospital Ranau is a government facility under the Ministry of Health Malaysia, serving as the primary referral center for Ranau and surrounding district. Our emergency and trauma unit provide comprehensive services including triage assessment, emergency resuscitation, trauma management, stabilization, and specialized referral. We are committed to delivering accessible, safe, and quality healthcare aligned with national objectives. We face three primary challenges. First, increasing patient demand causes overcrowding, heavy workload, staff fatigue, and prolonged waiting times. Second, communication and coordination difficulty in our fast-paced environment can lead to clinical error and treatment delay. Third, rapid technological advancement and changing patient expectation require continuous staff development. These challenges directly impact staff morale and service quality. Using Shin 3 level model, we analyze our culture. Our artifacts include triage system, shift handover, and emergency protocol. Our espoused value emphasize quality care, professionalism, and accountability. Our underlying assumption reflect the belief that patient welfare and teamwork are essential. While our culture demonstrates strong professionalism, commitment to patient safety, increasing demands and resource constraints create stress and burnout risk. Our leadership combines transformational and transactional approaches. Transformational leadership inspires shared vision, encourages innovation, and supports professional development through mentoring and quality improvement initiatives. Transactional leadership ensures protocol compliance and effective task management during critical situations. Moving forward, more participative leadership practices could strengthen employee engagement and organizational commitment despite ongoing staffing pressure. Effective communication occurs through shift handover, patient referral, clinical documentation, and multidisciplinary meeting. We utilize the SBAR framework, situation, background, assessment, recommendation to structure critical information transfer. However, high patient volume, overcrowding, and time pressure affect information exchange. Communication failure remain a major contributor to patient safety incident. We address this through continuous training, simulation exercise, and promoting psychological safety. Applying Pacman team development model, we recognize that effective teamwork requires progression through forming, storming, norming, and performing stages. Our strengths include strong interprofessional collaboration during trauma resuscitation and critical care, with senior staff actively monitoring junior colleagues. However, workforce shortage, high patient volume, and hierarchical structure can challenge teamwork. We continue promoting psychological safety and inclusive participation. Employee behavior is influenced by multiple factors. Herzberg two-factor theory identifies hygiene factor like salary and working condition plus motivational factor including achievement, recognition, and growth opportunity. The job demands resources model shown that excessive demands can lead to burnout, while organizational resources enhance engagement and resilience. Burnout is a significant concern in emergency department. Positively, continuous professional development enhance clinical competence, confidence, and motivation. Employee behavior is influenced by multiple factors. Asberg two-factor theory identify hygiene factor like salary and working condition, plus motivational factor including achievement, recognition, and growth opportunity. The job demand resources model shows that excessive demands can lead to burnout, while organizational resources enhance engagement and resilience. Burnout is a significant concern in emergency department. Positively, continuous professional development enhance clinical competence, confidence, and motivation. A learning organization continuously facilitates learning and transform itself through knowledge acquisition, sharing, and application. In healthcare, this is essential for adapting to evolving medical knowledge, technological advances, and changing patient needs. Our unit demonstrates learning organization characteristics through continuous professional development, knowledge sharing, and quality improvement. We evaluate our practices using Senge 5 discipline, personal mastery, mental models, share vision, team learning, and system thinking. Personal mastery reflects individual commitment to continuous learning. We demonstrate this through CPD program, including emergency life support training, trauma management courses, simulation exercise, and competency assessment. The Ministry of Health require annual CPD points for license renewal. However, participation faces constraint from staffing shortage, workload pressure, and limited opportunity in rural setting. Continued organizational support is essential for sustaining a culture of professional excellence. We actively challenge mental model through clinical protocol review, morbidity and mortality meeting, case discussion, incident reporting, and root cause analysis. These practices encourage reflective learning and evidence-based practice. However, resistance to change may occur with new technologies or process. Long-established practices and hierarchical structure can limit adaptability. Effective leadership, continuous education, and open communication are necessary to foster innovation and organizational learning. Our unit operates under the Ministry of Health Malaysia Vision, emphasizing quality, safety, accessibility, and patient-centered care. Some share the common objective of delivering timely, effective emergency healthcare. We communicate this vision through departmental meeting, staff briefing, and performance review. However, maintaining shared vision during high workload period is challenging. Leaders must continuously reinforce organizational goals and encourage staff participation to sustain commitment and motivation. Team learning occur through multidisciplinary case discussion, clinical audit, emergency simulation, peer mentoring, and post-incident debriefing session. Senior staff mentor newly appointed personnel, facilitating knowledge transfer and professional development. This activity improves clinical competency and support continuous quality improvement. However, opportunity for structured team learning may be limited by staffing constraints and operational demands. With the emphasis on protected learning time could further strengthen collaboration. System thinking enables understanding how organizational components interact and influence overall performance. Our unit demonstrates this through collaboration with hospital department, primary healthcare clinic, ambulance services, specialist referral center, and external agency. Quality improvement initiative, incident investigation, and patient flow management reflect system thinking principle. Rather than addressing problem in isolation, we examine root causes and consider how different factors interact to produce outcome. Short-term CPD strategy focus on immediate skill development. We conduct regular in-service training covering basic life support, advanced cardiovascular lab support, trauma management, triage assessment, and infection control. We also conduct simulation exercise, mock disaster drill, multidisciplinary case discussion, and mortality morbidity review. Mentorship program support newly appointed staff. Research confirmed that simulation-based education improves clinical competence, confidence, and patient safety outcome. Long-term strategy include supporting advanced education and specialized training, leadership development, fostering a lifelong learning culture through research and quality improvement project, digital health technology adoption, and succession planning. However, barriers include limited financial resource, staffing shortage, geographical constraint, and competing services demand. These challenges are particularly acute in rural healthcare settings. Organizational commitment and strategic investment are required to sustain workforce development efforts. Our analysis demonstrates that organizational behavior and learning organization practices significantly influence workforce performance and patient outcome. Strengths include professional culture, effective collaboration, structured communication, and strong CPD commitment. Challenges include increasing patient attendance, workforce shortage, and burnout risk. We recommend participative leadership, ongoing communication training, prioritizing employee well-being, and strengthening learning organization characteristics. Continued investment in staff development will enhance organizational effectiveness and patient care quality. That's all. Thank you for your attention.